Which of the following is the primary purpose of extracorporeal membrane oxygenation, ECMO? A. To enhance renal function. B. To provide long-term heart support in patients with chronic heart failure. C. To provide short-term circulatory and respiratory support for patients with severe cardiac and/or respiratory failure. D. To replace dialysis in patients with kidney failure. Answer: C. To provide short-term circulatory and respiratory support for patients with severe cardiac and/or respiratory failure. Explanation: ECMO is a life-saving intervention used in patients with severe, reversible cardiac and/or respiratory failure. It provides both heart and lung support for patients who cannot be adequately oxygenated or ventilated by conventional methods. It is not intended for long-term use or to address renal failure. Which component of ECMO is responsible for oxygenating blood? A. Pump. B. Oxygenator. C. Cannula. D. Membrane. Answer: B. Oxygenator. Explanation: The oxygenator in an ECMO circuit is responsible for oxygenating blood and removing carbon dioxide. It functions similarly to the lungs, facilitating gas exchange during extracorporeal support. The pump circulates the blood through the system, while the cannula is used to access and return the blood from the patient's body. In which of the following conditions is ECMO most commonly used? A. Severe acute respiratory distress syndrome, ARDS. B. Stable coronary artery disease. C. Chronic obstructive pulmonary disease, COPD. D. Diabetes mellitus with hypertension. Answer: A. Severe acute respiratory distress syndrome, ARDS. Explanation: ECMO is primarily used in severe cases of ARDS, when conventional mechanical ventilation is insufficient to oxygenate the patient. It is also used in cases of severe cardiac failure, particularly when both the heart and lungs are failing simultaneously. Conditions like stable coronary artery disease or COPD are typically not indications for ECMO. Which type of ECMO configuration is most commonly used for respiratory failure? A. Veno-arterial, VA, ECMO. B. Veno-venous, VV, ECMO. C. Arteriovenous, AV, ECMO. D. Direct blood oxygenation. Answer: B. Veno-venous, VV, ECMO. Explanation: Veno-venous ECMO is commonly used for patients with respiratory failure, where the heart is functioning adequately, but the lungs are unable to perform gas exchange. The blood is drained from a vein, oxygenated outside the body, and then returned to the venous system, bypassing the lungs. What is a major risk associated with ECMO? A. Electrolyte imbalance. B. Hemorrhage and thrombosis. C. Increased lung compliance. D. Respiratory alkalosis. Answer: B. Hemorrhage and thrombosis. Explanation: One of the major risks of ECMO is hemorrhage due to anticoagulation therapy required during the procedure. Additionally, thrombosis, blood clots, can form in the ECMO circuit or in the patient, posing further risks. Monitoring and management of anticoagulation are crucial during ECMO therapy. Which of the following is not a typical complication associated with ECMO? A. Infection. B. Organ dysfunction. C. Hemolysis. D. Increased cardiac output. Answer: D. Increased cardiac output. Explanation: ECMO is designed to support cardiac and respiratory function, but it does not directly increase cardiac output. Instead, it assists in oxygenation and perfusion. However, complications such as infection, organ dysfunction, and hemolysis, damage to red blood cells, are common due to the need for anticoagulation, long-term mechanical support, and exposure to the ECMO circuit. Which of the following is a contraindication for ECMO therapy? A. Severe, reversible respiratory failure. B. Major bleeding disorder. C. Cardiac arrest with no pulse. D. Irreversible multi-organ failure. Answer: D. Irreversible multi-organ failure. Explanation: ECMO is not typically used in cases of irreversible multi-organ failure because it is unlikely to benefit patients with no potential for recovery. While it may be used for severe, reversible respiratory or cardiac failure, it is contraindicated in cases where recovery is not anticipated. What is the primary mode of cannulation in venovenous ECMO for respiratory failure? A. Femoral artery and internal jugular vein. B. Internal jugular vein and femoral vein. C. Subclavian vein and carotid artery. D. Carotid artery and femoral vein. Answer: B. Internal jugular vein and femoral vein. Explanation: in venovenous ECMO, cannulation typically involves inserting one cannula into the internal jugular vein for blood drainage and another into the femoral vein for blood return. This setup allows for venous blood to be oxygenated outside the body and returned without affecting arterial circulation. During ECMO, why is anticoagulation therapy necessary? A. To prevent blood clot formation in the ECMO circuit. B. To enhance oxygen delivery. C. To reduce the need for mechanical ventilation. D. To prevent infection. Answer: A. To prevent blood clot formation in the ECMO circuit. Explanation: anticoagulation therapy is essential during ECMO to prevent blood clots from forming in the ECMO circuit. The blood is circulated outside the body, and without anticoagulation, there is a risk of thrombosis, which could damage the circuit and the patient's blood vessels. How is ECMO weaning typically performed? A. By gradually reducing the flow of oxygen in the circuit. B. By discontinuing anticoagulation therapy. C. By progressively reducing ECMO support as the patient's heart and lungs recover. D. By stopping the mechanical ventilation. Answer: C. By progressively reducing ECMO support as the patient's heart and lungs recover. Explanation: weaning from ECMO is a gradual process where support is reduced as the patient's heart and lungs begin to recover. This process involves careful monitoring to ensure the patient can tolerate reduced support before ECMO is completely stopped. It is not done by reducing oxygen flow or discontinuing mechanical ventilation abruptly.